Hi, I'm Dr. Joshua Chong, and this episode is kind of like a commemorative episode for us here at Hair Talks by Terra Medical. It's been a nice journey. We've done about 95 episodes of educational, unbiased, evidence-based content about hair loss and hair restoration, demystifying and detechnicalizing a lot of the information out there for you, our precious audience. We've gotten to the mark where we're about 1,000 subscribers, and that might not be a lot to most of you, but it's very precious to us to know that 1,000 people kind of tune into our content regularly. 166,000 views of our videos. That tells us it's reached quite a lot of people, given them some important, valuable points on how they can start their hair restoration journey. 5,200 hours of watch time. Thank you all for your support all these years since 2021. These might all sound like numbers to you, but to us, hair is kind of a numbers game. It's a lot about biostatistics, about density, implantation density, harvesting density, dosages. It's all about numbers. And in this episode, we want to kind of bring you back to that point and talk about the numbers relating to hair loss and hair restoration. So just a recap on the numbers, I think the numbers in terms of statistics with regards to hair loss hasn't changed all that much over the decades. Certainly a few papers that have been published have shown that Western numbers and Asian numbers do correlate quite closely, and we're talking about androgenetic alopecia incidence. So the lifetime incidence of androgenetic alopecia or male pattern baldness for guys tends to be about 70%. By age 45, and when you're about age 80, that's more like 100% will experience some degree of androgenetic alopecia. The question is whether or not it is cosmetically affecting the patient. So it could be as low grade as Norwood 2, which is just the corners of the hairline maturing slightly, all the way to a Norwood 7. So those values on how many people eventually become a Norwood 7 is unknown to us. Some people don't let it go to that stage by intervening early with medications such as finasteride, which still has a 1 to 3% incidence rate of having sexual side effects, such as erectile dysfunction or a decrease in libido or sex drive. We know those numbers pretty well because this medicine has been around for 40 years. And when it comes to the female population, we're talking about 45 to 50% of women developing hair loss by age 40. And when we talk about this, we're also referring to female pattern hair loss, which is classed as androgenetic alopecia. But we know now that there are lots of ladies that would benefit from the epigenetics of the female pattern hair loss syndrome, such as 91% of patients that have female pattern hair loss actually have vitamin D deficiency. About 83% of female pattern hair loss sufferers also have zinc deficiency. So these numbers all help us make a calculated guess as to how are we going to approach the situation nutritionally for that patient, as well as how they're going to respond to various treatments. Other examples of numbers will be that we know that finasteride benefits 91% of men in the first year, about 87% of men in the second year, 81% of men going into the third year, and somehow in the fourth year that number drops to about 66% of men that self-report that finasteride is still working well for them, which means about 1/3 of men start to see a diminishing return at about the fourth year mark when they're using finasteride alone. It's important for your hair restoration practitioner to recognize that there's this diminishing return effects in finasteride and plan surgery according to that, and also understand what alternatives and what add-ons, adjunctive treatment there are to finasteride when it comes to treating male pattern hair loss. We also have brought in Nocrin since we have found out that the incidence of hair loss after getting COVID is about 22%, but this is not called androgenetic alopecia, we call it telogen effluvium, or a heavy shedding condition. And we know that Nocrin works for about 83% of women and about 85% of men in restoring acute telogen effluvium. At the end of 6 months, you're talking about 18% increase in hair counts. These numbers are all well studied and known to us. As I said, hair is a numbers game. We also know that the lifetime incidence of alopecia areata or AA is 1 to 2%. So out of 100 of your friends that you know, there's going to be 1 or 2 of them who suffer one isolated balding patch at one point of time in their life. And these patients so come to us understanding that this balding patch has about a 5 to 10% recurrence rate if they've gotten it once before. We also know that vitamin D is very related to alopecia areata, and in recurrent alopecia areata, we find that about 81% of those sufferers are vitamin D deficient. I could go on and on about numbers, but we've grown so much in the clinic and on YouTube, and we have no plans to stop. So thanks for tuning into this episode, and here's to the next 1,000 subscribers.